Thank you, Ajanta Pharma and LV sir for getting me here. So, friends, what I am going to talk is about the wide field imaging system. Well, we are aware we have been doing angio with 30, 45 degrees, and this is what we do. Usually, I will show some images. This is the standard conventional photograph which we do about 35 to 40 degrees of fundus which we see. If we do an ETDRS, we see about 75 degrees of the fundus. And if we do a wide field, it comes to about up to equator, that is 100 degrees, and ultra wide field is up to ora serrata. So why is ora serrata to be seen, up to ora serrata to be seen? Let us understand. These are the various options, instruments available, and these are the features which they have additionally beyond imaging, which I will not talk because it is not in context. Well, Whitefield OCT also Ritesh has already spoken about, and especially the lesions you can, if it is a big lesion more than 8 to 10 millimeters, and if you have a scan size of only 12 millimeter, you cannot get a in toto image or the viewing of that particular fundus, and that's why even Whitefield OCT is a must. I will show you across how some clinical situations why Whitefield imaging is a must in day-to-day practice today. Now, looking at this case, this is a case of a diabetic retinopathy treated elsewhere, and he has a bleed. This is what we see on a standard fundus photograph, 40 degrees, and this is almost up to equator, where you can see more. There you can see that the lasers is scarcely done, not adequately done, and if you do an angiogram, you can actually see the skip areas, that is the ischemic areas, much more wide, even beyond the equator. The older concept was that when we do panretinal photocoagulation, do up to the equator. But this particular picture will show that the ischemia extends quite beyond equator up to ora, and that's why the need of treating complete aggressive lasers is important. Now, coming to a case of retinal vein occlusion, this is what we see in a standard case fundus photograph, and this is the picture. And now you see a wide field angiogram. If you can see the CNP areas, that is the capillary non-perfusion areas, are more than 35-40 disc diameter. So this is a high risk case which should be treated with laser and not just observation. Now, this is a case of a pulmonologist who was under our care for branch retinal vein occlusion. We had standard fundus photograph and camera. We did an angiogram. We treated him with standard line of management with multiple anti-VEGF injections, but his edema kept on coming. And that is when we decided to do ultra-wide field. And this is the angio which showed the ischemia extending quite beyond the periphery, beyond the equator. And so now we decided to do a targeted laser only to the periphery, and fortunately for us, when we treated him, this is the picture when we got about a month later, which persisted few months down the line. So what we learned? Yes, ischemia in a case of vascular retinopathy extends much beyond the equator, and many a times macular edema needs a treatment in a peripheral leisure areas, CNP areas, and that is the need of ultra-wide field angiography. Now, this is a patient who was referred to us as a case of a macular edema, and when we did ultra-wide field OCT, you can see the sciatic cavities extending much beyond the extent. So this was a case of a retinoschisis, but we thought we are seeing something more, and so we decided to do an angiogram. If you see the left eye, the vascular pattern is okay, but there is a macular edema. But if you see the right ultra-wide field, you can see that there is a vascular tortuosity or the looping, that is a new vascular response, which is well described in the literature, which is called a retinoschisis with a vascular response, which also needs a treatment. Now, another case. This is a case of a 52 years female who had diagnosed as a ERM. And when we did a surgery, this is what you can in fact see, a Ozudrex implant lying at the ora serrata in this particular case. Now, this is another case. This was a patient who came to us as a case or referred as a case of a partial retinal detachment. We saw some fibrous tissue here. We thought we are seeing similar fibrous tissue. Well, this is a case of a FEVR, which could never be ever picked up on a standard fundus camera because this is quite beyond the equator, the neovascularization. And this is the post-op photograph of the same patient. Now, this is a patient with hypercholesterolemia, and you can see this is the picture, and you can see a sprung blood vessels, and so aggressive was the avascularity and needed treatment. And this is the picture. This is the beauty of ultra-wide field, and we can see so much, and we can assess the intensity of the aggressiveness of this particular case. This is a case which was referred to us a few days back, just last week. And this patient had a macular hole and was referred to us as a case of macular hole. But if you see the picture in toto, you will understand it's a something global ischemia is there, and this is a capillary the vascular shutdown across. In fact, the left eye has even the macula, it is not crossing. And this patient had some uremic condition, and he was almost having a global body ischemia. Now another case where I will show you, this is a case of a healed choroiditis. This is what we see on a standard photo, and this is 160-degree. And we did an angiogram, and we could see that in the right eye, besides the healed power, there is also a dropout areas. So which also needed treatment or has to be watchful, because this is likely to develop new vascularization. Now this patient had a combined RD in one eye and was referred to us as a case of for vitreous surgery. We had a combined RD, yes, but left eye, you can see the blood vessel pattern was something abnormal, which we would never have picked up on a standard fundus camera. We decided to do an angiogram, and this is the picture. This is a case of a Takayosis disease. This was an ophthalmology cover page few months back for us. Now, this is another case. This is a girl who was referred to us, whose father was operated for a vascular tumor. Grandfather had brain surgery, and she had thusical eye, one-eyed. And this is the picture which we saw. We advised angiogram, and on a standard fundus, this is 100-degree, we would have missed this vascular tumors. And you can see this is a ultra wide field where you can see multiple tumors. So this is a case of a angiomas von Hippel-Lindau. We treated her with a standard treatment of lasers with triple freeze trio. Father was asymptomatic. We screened him again with an angiogram, and as you can see, multiple angiomas which were silently lying, which we would never have picked up on a standard fundus camera. Same thing. Now the brother was asymptomatic. We decided to do, and this is the picture on ultra wide field. So we charted. We treated him as well, and this is about a year later. We need to repeat angiograms every yearly in such cases of angiomas, and you see again there are new vessels or new angiomas which needed further treatment. We did the genetic mapping and all, and we moved ahead. Another case of this particular patient, this is a case of a peripheral PCV, which we could never imagine or image with the help of standard fundus cameras, and a wide field OCT through the lesion helps you in monitoring and treating these particular cases. When we treated, we could follow up the height of the image, how is it coming down, how the peripheral lesion is healing. Now another case of a VKH where you can see the picture in toto and understand the intensity or the aggressiveness of this disease. I would just run through it for want of time. This is another case which was referred to us as a case of a macular edema. Just simple complete fundus photograph shows it is a retinitis pigmentosa associated with a central retinal artery occlusion. Again, this is a premature baby who was referred to us as a case of ROP. This was a standard fundus photo, and if we do ultra wide photograph, you can see not only metastasis but also vitreous seedlings. This is how it gives a complete panoramic view of the whole disease process. Another case of a leukemia where you can pick up the disease. This is again a cover page this month published in Eye Journal, which is a triad of leukemia, which not only shows you the leukemia means metastasis, but also infiltration of vessels as well as the Roth spots. So this is how you get complete evaluation of the fundus here. And this is another case which was referred to as a case of a trauma with Berlin's edema. I had to really shake my head and make him understand there is a tear. So finally we got the photograph and we could show him the photograph. Patient was convinced for treatment. So similarly, you have this was a case which was referred to us as a case of a macular edema. This is a subclinical retinal detachment with a horseshoe tears. So these are obvious cases where this utility in convincing the patient it becomes very easy, and it is easy to make this patient understand their pathology and help them in proper treatment. Now this is another case of a decompression retinopathy where you get a complete picture. Yes, there are limitations. These are not true colors, costly things, need a lot of money. And many times people ask, what is the ROI of this machine which is costing in crores? But this is the ROI for us. These are the cover pages which we could achieve. In last 1 year, we have 3 cover pages of ophthalmology bias and 2 eye journals. Thank you once more for the patient hearing.
Prashant, we are so envious of your pictures here that we were seeing on the screen only. वहाँ पे बहुत अच्छा दिख रहा है.
Thank you, sir.
So I think the bottom line is 45 degree vis-a-vis 200 degree. So what we are all missing, and that was the message. In fact, everybody is so lazy. Nobody today gets up and scans all the quadrant, the indirect. But everybody wants to do a wide field imaging. It includes all the things: angiography, imaging, as well as OCT. He spoke about all the three things. All it will include. But believe me, it's a tool which every retina surgeon should have. I'm not asking a TS7 surgeon to have this, but all retina surgeons should possess this. Believe me, he showed more than 12 examples where everybody has missed, especially that last which you showed. It's a wonderful tool. Remember, 45 degree is convention, 100 degree, that is till the vortex vein, is wide field, and up to ora serrata, that is 200 degree, is what he has shown. So wonderful. Thanks a lot.
Thank you, sir.
And I will ask one question to Vinod. Vinod, because RP Center, he has the maximum. What is your day-to-day routine about this? Do you do all cases on this or only select cases?
No, sir, we don't
Be very honest.
Yeah, we don't do all the cases. If it is a macular condition, we prefer conventional fundus photograph, as images are much better, clarity is much better. Conventional
but
photograph.
But macular to pata nahi lagega na, unless you see, he showed one patient pathology was maybe in this.
So that is what I was coming to. So ultra wide field imaging is very useful. It is eventually going to replace all of our conventional cameras. But what I feel is it cannot surpass the good clinical judgment. If you do not do
you advocate it or not?
Of course, sir, we do advocate, 100%. And I think it does not.
Can you do without it?
Yes, sir, we can do it in today's scenario, but it does not change the diagnosis. It never changes the diagnosis. So it is very useful for documentation, but not for diagnosing the patient.
AG, your view? We'll have next talk on uveitis. Yeah.
So I have one question from ultra wide field is.
No,
going
first you answer my question, then you ask question.
No. Whether it's going to replace indirect ophthalmoscopy or indirect ophthalmoscopy, because you are showing all the lesions and you are diagnosing.
I think Vinod said it's not such a widely used by all the retina people. It's not so commonly available because of money only. Like Namrata was talking about.
No, if the cost factor comes down, will you say that indirect ophthalmoscopy will go off?
No, Titial was talking about 1 crore. You see, it's an expensive machine. Question is, how much value does it add to your day? Our topic is retina in day-to-day practice. In day-to-day practice, do you advocate it or not? Yes or no?
So for retina surgeon, yes, but for a general ophthalmologist.
Okay. Avninder is a big politician. He will not come out with one
another
answer.
Thing where where ultra wide field really helps is pediatric cases, because this is a flashless photography as compared to the conventional 30 degree where you're using a flash. So people are very comfortable. It is very less time consuming, and definitely it gives you a comprehensive idea. So pediatric cases
I had
really
an
help.
Optos camera in my OPD for demo. I'm thinking in our hospital. The small pupil one, it makes a huge difference. We have a 3 or 4 millimeter pupil patient with synechia or undilating. You can see what you cannot see with the indirect. So today you will require it for certain. I think any hospital that has more than 100 patient OPD will think of breaking even with the.
Vishali, we agree. Small pupil pediatric patients is a must, I think, evaluation. So let's move on because time is not on our side. Thanks, Prashant. And now we have this soft-spoken gentleman from Chennai, Sudarshan, because I have always liked this talk every time, and I want him every time to come and speak on. Aim is how do I approach anterior and intermediate uveitis. I know you have a lot of examples, but how this audience should approach anterior uveitis.